Thank you guys for coming today. I'm going to give a little speech on the advancements of military and battlefield medicine in World War II. We're just going to start into the speech. So imagine that you're a 17-year-old young man on a landing craft in a storm Normandy. And you look to your left, you see a brother of yours getting ready to fight also. You look to your right, and you see another gentleman with a big red cross on the front of his helmet. That big red cross means a lot of things, and that gentleman is there to save your life. I'll explain all that in a little bit. But we'll start off with the injuries of World War II. Unlike World War I, World War II introduced artillery rounds and mortar rounds. These are high explosive rounds. They not only cause penetrating trauma, but they also cause blast injuries, which would be very, very difficult to treat. Weaponry of World War II kind of it gained a lot of velocity in the rounds, which caused a lot more trauma to people that these young 17, 18-year-old combat medics had to deal with as well. And then the last injury we'll discuss are burn injuries, and those came from flamethrowers. World War II is pre-Geneva Conventions, which means flamethrowers were still allowed on the battlefield. Today, they're not. Talking to that, being a flamethrower man was kind of a double-edged sword, because you were feared by everybody, but you were also a target for everybody. I'm going to talk about the medical providers of World War II. There's really three tiered providers. Physicians were the top tier, nurses were their assistants, and then combat medics were the enlisted gentlemen. Combat medics were considered the lowest trained people in the medical tiered system. They did carry with them a lot of advanced medications, to include sulfa powder, which is an antibiotic. Everybody's probably heard of sulfa. A lot of people are allergic to sulfa now. The way that worked was, as soon as somebody was injured, sulfa powder was to be administered directly into them to start fighting infection. Did a very good job of that, if you will. The next provider up would be a nurse. A lot of the nurses, believe it or not, were civilian trained and were essentially civilian nurses that just showed up and said, I want to fight, or I want to assist and serve my country. They never actually got a commission until 1944. Like I said, they were civilian trained. Little interesting tidbit, the flight nurses of World War II were all trained at Bowman Field here in Louisville, Kentucky. A lot of people don't know that. Well, they're in Louisville, Kentucky. The highest trained medical providers were their physicians. Regardless of specialty, you acted as a battalion surgeon. Surgeon is just a title. They're not actually cutting on everybody. They are expected to hold sick call for people that are sick. That's essentially what it means. And they're also expected to treat emergent patients, stabilize them, and push them down the road. So now that we've discussed who they are, we'll discuss what they did. So combat medics actually deployed into the battlefield with soldiers. A lot of them got a bad rap because they were conscious objectors. If anybody's seen the movie Hacksaw Ridge, that does a very good job of explaining what conscious objective medics did in the battlefield. In training, they were despised because of this. In the battlefield, they were revered because they wanted to battle without a weapon. And they put their life on the line to help their brothers. Their main job was to stabilize, treat immediate life-threatening injuries, and move them back to the rear as quick as they could. Now, today, the rear is 4, 5, 6, 7 miles because we've got helicopters and all that cool stuff. Back then, it was yards, hundreds of yards kind of thing. They did this with updated ambulances. Into World War I and the very beginning of World War II, we were using mule-drawn carriages to move people from the battlefield, which I know is amazing to us because there's still people alive that would have experienced that from the 30s. Military implemented engine-driven ambulances, and all that did was shorten the amount of time they got to move the person back to the battalion aid station. At the battalion aid station, physician would stabilize surgically, reassess injuries, and remove and apply bandages. We still kind of use that system today, but again, we've shortened the time it takes to move, and we've elongated the distances to keep our highly trained surgeons away from the battlefield as much as possible. So there was quite a few. This is where we'll get into the advancements and what we still use today. So sulfa talked about being a powder that was administered for antibiotics to fight bacterial infections. did a phenomenal job. Penicillin. Penicillin was discovered in 1928, but it was looked at as a gimmick. Nobody went ahead to do it. They didn't think it worked. It was actually discovered in Britain. British company was kind of pushing around, went to the U.S. The UK said they were not going to buy it, they were not going to build it because they were already putting all their money into the war fight. The U.S. said, yeah, we'll do that, and they actually, Pfizer was the company they partnered with, and Pfizer did a really cool thing. They synthesized it, and they made the drug, and they shared the patent and all the information with every other pharmaceutical company in the United States to try to get this built up to send over to the war. Even with that, they still made more money than all the other providers combined, or all the other pharmaceutical companies combined. Another one that is not as interesting is Atabrine. It's anti-malarial. So we fought two fronts. We fought the European front, and we fought the Pacific front. Pacific front, the scare there was malaria, so they got these drugs out. I can tell you from my experiences, being in the military and taking anti-malarial medications, a lot of the GIs back then reported psychotic dreams and episodes, and how it really messed with their psyche, and they refused to take it. That still happens today with all of our anti-malarials. I went to Afghanistan for a few months. I didn't take mine, which is kind of bad for a medic to say, I'm not taking that stuff. But it got so bad that the company docs, when I say doc, I mean combat medics, company docs and the first sergeants would sit outside the chow hall and confirm that everybody took their medicine, or they wouldn't let them leave. So another very important battlefield medicine that was developed, not so much developed, but packaged appropriately, was morphine. That's very important to everybody, especially if you're injured. With morphine, they didn't really synthesize anything different. They just repackaged it, and it was Squid. That's another pharmaceutical company. They developed these things called syrettes, which is a 0.5 grain, which we don't really measure things in grains anymore, but a 0.5 grain syrette that can be injected, squeezed, and that was it. With this, if they can give them enough medication, they would kind of comatose them enough so a surgeon can get a hold of them and start working on them, give them a little bit more powerful pain medicines. Apologize. One that there was a drug that was developed, and instead of sending it overseas to the guys that are already fighting, both European and Pacific theater, they decided they're just going to vaccinate people, and that was a tetanus vaccination. If you've ever heard of the Battle of Dunkirk, she knows it's one of my most interesting battles. Hitler could have absolutely won the war, but for some reason he stopped, and nobody understands why. They evacuated 242,000 Allied soldiers in, I believe, 2 days, just with civilian fishermen from the UK that decided to drive their boats across and help. 17,000 soldiers were wounded in the Battle of Dunkirk. 0 contracted tetanus because of the tetanus vaccination. I believe that's a pretty amazing feat. There were a few procedural advancements. One of the big fears, and especially in the UK, was chemical warfare being shelled. If you ever see pictures of babies being pushed around in carriages, they had baby gas masks. Everybody had a gas mask in the UK. It was something, if you speak to your parents, grandparents, you never really dealt with over here in the States. For the UK, it was huge. They developed, and I don't really know how to say the word, they developed a new charcoal canister for these gas masks to help with sarin gas and all the fears of what Germany would, or the Axis would detonate on them. Another thing that was not so much created or invented, but what is the word I'm looking for? Something they did very well was blood transfusions. They were able to give either plasma or whole blood in the field at the battalion aid stations. Not so much a point of injury, but you get them back and you can start giving blood to the field. Other soldiers would literally lay down next to them, and they would just hook a transfusion line in and go from soldier to the wounded. There is a Dr. Archibald McIndoe. He did something very amazing. He pioneered a lot of burn care treatments for air crews that were burned in crashes and all that kind of stuff. He looked at it as a holistic approach, as to where not only did he develop surgical techniques, but he also implemented them back into the community and wanted them to not suffer so much from the stigma of burn scars. Actually created a program to where when GIs got back from the war, they would be assimilated back into strangers' homes, and he would ask if people would invite them in for dinner and all that kind of stuff. Just kind of don't make them feel like they're outsiders. So there, you can kind of understand now that sending combat medics into a war zone with a little bit of medical experience is beneficial, because you can save the guys that are fighting now instead of having to replace them. There is one more thing that I will not discuss, and that is the medical experiments that Nazi Germany performed on people. I don't discuss that for a reason. I think it's atrocious. However, I do believe in my heart that letting that information not be used and go by the wayside is kind of a vain approach to it also. I purposely did not study that. I did not research that because, again, that was some grotesque things that they were doing. So those are the medical advancements. Quick speech on World War II. Anybody have any questions?